am Sarunjos, Assistant Professor, SNS College of Pharmacy and Health Science, Coimbatore, and today we are going to discuss the topic about pharmacology. The word pharmacology, which is derived from the Greek word pharmakologos. So, pharmaco means drug and logos means study. So, the study of drug is known as pharmacology. The pharmacology is a branch of medicine that deals with the study of drug and their effect on living organism. How the drug effect on their living organism is known as pharmacology. Living organism means nothing like plants, virus, bacteria, fungus. So all the living things are known as living organism. It explores how the drugs are discovered, how they are work, how the new drugs are discovered, how they are work in our body, and how they are used to prevent, diagnosis and treat disease. This is how study how they are used to prevent the disease, diagnose the disease and treat the disease. So first we want to know what is drug. So drug is a chemical substance. Drug is nothing, a chemical substance which introduced into the body, either oral, parenteral or any other routes. The drug is administered to the body which alter the normal biological function, A drug is a chemical substance. When introduced into the body, it altered the normal biological function, is known as drug. Drugs can be either natural, which is derived from the plant like morphine, or either synthesis, example paracetamol, ibuprofen. These are the drug which is synthesis in the laboratory. And next one is the biotechnological. Biotechnological synthesis, example like insulin, vaccines are come under the biotechnology category. So main division of pharmacology. The pharmacology is majorly classified into two groups. So first one is an pharmacokinetic. So pharmacokinetic, which means what the body does to the drug. When administered drug into our body, what happened? What body happened to the drug? So first one, absorption, how the drug enter into the bloodstream. The absorption is a study of how the drug enter into the bloodstream, and distribution, how it spread to the body. How the drug is spread to the various organs like liver, kidney, how it is spread to the different organs in the body. Metabolism, how it's break down mainly in the liver. Metabolism is occur in the liver, how the drug is break down into the smaller particle, or how the drug is excreted through the urine. So before excretion, it want to metabolize, it want to chemically change from one molecule to another molecule, is known as metabolism. And excretion, how it is eliminated through the kidney, bile or sweat gland. So various route the drug are excreted. So that is studied in the part of excretion. So pharmacokinetic is nothing, what the body does to the drug. Okay. And next one is a pharmacodynamic. Pharmacodynamics, what the drug does to the body, nothing but the drug does to the body. We can easily understand. Dynamic, D indicate drug does to the body, and kinetic indicate body does to the drug. Okay, so in pharmacodynamic we study the mechanism of action, how the drug is produce their action, where they are going to bind and produce their action, where they are going to block and produce their action. And drug receptor interaction, how the drug and receptors are interacted to produce their action. And dose response relationship, how many amount of dose can produce a particular action, how many dose of drug that produce a toxic reaction. So that are going to study the dose response relationship. And therapeutic and toxic effect, the drug therapeutic and toxic effects are seen in the pharmacodynamic topics. And next on the source of drug, already we see the drugs are derived from the various sources like plant, animals, minerals, synthesis, semi-synthetic hormone and biotechnology. And plant example like digitalis. So digitalis, which is used to the treatment of which is a plant component which is used to the treatment of cardiovascular disease like Catranthus rosas, which contain the digitalis, and digoxin, which is used to the cardiac related disease. And like cinchona bark, which is a type of bark of the plant which contain the quinine and quinine, which is used to treat the anti-malarial drug, which is used to treat the malaria, which is act as an anti-malarial drug. And animal source like insulin, some insulins are in olden days, now insulin is in the laboratory. In olden days they are use the insulin Alternative is an animal insulins are used as the alternative, and minerals for iron. If the person have iron deficiency, we treated with the iron drug. If it calcium deficiency, we treated with the calcium related drugs. And synthetic and semi-synthetic compound. Next one, biotechnology, recombinant DNA product like CRISPR-Cas9 technology and various vaccine production technologies are come under the biotechnology. And route of drug administration, the route are classified into various types, but here we are seeing the simple types. First one, oral we can give in the form of tablet or capsules, and parenteral route we have given the various route like injection form we given IV means intravenous, IM means intramuscular, and SC means subcutaneous. Also there are various route intraperitoneal, so there are more route in the parenteral administration. And topical route, eye and skin. So eye we are given eye ointment, eye drops, etc. And skin we are also given sunscreen, so different type of cream and ointment. And inhalation gases and aerosol, which is used to treatment of uses treatment for pulmonary disease and asthmas. And next one, the importance of pharmacology. So why the pharmacology is important in pharmacy? Without the studying pharmacology, the pharmacy is nothing. So pharmacology is help to the identify safe and effectiveness of drug use. How the drug is safe and effective, we can use how the drug we can use safe and effective, and guide the dose and treatment planning. We can planning the treatment according to the drug mechanism of action and drug therapeutic effect, and also fix the dosage and prevent the adverse drug reaction. Based upon the dosing, we prevent the adverse drug reaction, and essential for drug development and research, and which is essential for drug development. From the old compound we can synthesize a new compound, and which is throughout the research. So these are the basic things about the pharmacology. So pharmacology is nothing the study of drug and their effect in living organism. They alter the normal biological function in the body. So these are the basic thing we studied about the pharmacology. Thank you.